and unfortunate that they weren't able to, in 2017, repeal and replace Obamacare. He ran on that. He really wanted to do it. But as you know, John McCain was a stumbling block, and it didn't happen. But Mr. Trump, was going to reduce, allow more people to get more types of coverage, expanding on the short-term limited duration plans, association health plans. He was, promoting price transparency so people would know what they were paying for a procedure when they went to the doctor or to the hospital. So all of these things, were terrific things that he supported. He wanted more competition. He wanted to, as he said in the late fall, he wanted to empower doctors and patients. He wanted patients to have the choice in the type of health care they want, not empowering the government, which, of course, is what we're seeing now.
Sally Pipes is my guest. She is president and CEO of Pacific Research Institute. Sally, do you think it's fair to say that the majority of Americans are really too afraid to have health care, have the private sector completely run health care? They don't trust the private sector enough to allow the private sector to run health care. They've been trained to fear the private sector and to embrace government to the point now where a discussion about unraveling government entanglement in health care we can't even have anymore?
Well, first of all, Larry, we don't have a complete private market in healthcare in this country, as you know. Yeah. 50% of our healthcare is in the hands of government through Medicare, the program for our seniors, of which covers 65 million, Medicaid, the program for low-income people that covers now 70 million Americans, the CHIP program, the Veterans Administration. So we don't have a private market. But the progressive liberals like Alexandria Ocasio-Cortez, the mainstream media, have just brainwashed the American people to say that the private sector cannot provide the kinds of alternatives and different types of plans for people. So people have been completely bamboozled. But it's interesting that, 59% of people polled say they support single payer, a complete government takeover of healthcare, which Bernie Sanders wants. Right. But when you ask the people, 160 million of them, which have private insurance in the employer market, if you ask them, well, you're going to have to pay much higher taxes, support goes down to 37%. If you tell them we're going to take away your private coverage and everybody's going to be in a government plan, support goes down to 26%. The problem is people don't understand what it means.
And Sally, the very same people that are complaining about the vaccination rollout are perfectly content to have the government take over everything. Sally, we're going to have to leave it there. Sally, thank you very much for coming on. I appreciate it.
Thanks, Larry. Take care. Bye.
Now,